And heading back out to check in with our Gadget Guy Mike Yawney. Mike, we've known each other for about 4.5 years. That's how long I've been here. I think I know you pretty well, but I think we're about to get to know you a whole lot better.
Oh yeah, we're about to get intimate, Tara. Yeah, you're going to know me a lot better after this segment. So just kind of to bring you back to the beginning this morning, I did a test where they checked how reactive my arteries were, how active they were. They took all the blood out of my arm and then let go and let the blood back in to see how my arteries reacted. And then they took some blood, which is always a joy on TV. And then, of course, they hooked me up to an IV with some caffeine because I didn't have any coffee yet this morning because I had to fast. Now we are doing an ultrasound. And I've got to say, I always thought, Diamond, when you get ultrasounds, especially when ladies go on for them, they warm up the gel. That's not the case this morning. It's a little bit cold on the neck.
Yeah, sometimes that's what happens, right?
So you were checking my arteries. You're getting a picture of my arteries and how healthy they are. Is that correct?
Yeah, the idea is that now we're looking at how old your arteries are. So obviously we know your age, and if you want, I can tell you your age on television. You're a healthy 25-year-old. Yeah. So what happens is now, many people know their chronological age. I'm 40 years old, so okay. But what is the age of your arteries? Your arteries can age faster than you can. And so by doing this test here, by looking at the ultrasound, we're able to see really what your risk is of a heart attack or stroke and tell you the age of your arteries, or how old is your heart.
Okay, Deb's been looking around for a while. She tried one side of the neck, and then she said, this is my better side, so she's getting a reading. And I know I'm not really supposed to talk during this because it's making it difficult for her. Yeah. But I'm 37 years old. Now, what are you seeing on the screen, and can you pinpoint anything for the viewers at home so they know what they're looking at? Yeah,
the idea is obviously to screen the arteries for plaques, because plaques can start to develop in our arteries, and so that's the first thing that we look for, is to see, are there any plaques in there? Is there anything that's restricting blood flow? Okay. And of course, it's just a screening test, so we're just trying to see if you are at risk of a heart attack or stroke. And then we'll bring these images onto our computer, and with our cool software, we're able to tell you then what the age of your arteries are. So that's the cool part about today, and to find out really what the age of your heart is, and I'll tell you that here shortly.
Now, can you point to the screen to let everyone know at home what people are seeing? Like where my arteries are?
Yeah, so when we're looking at the screen here, this is the arterial wall, and we want to see it nice and black, so obviously the blood's flowing well. And Deb screened the arterial wall to make sure there's no plaques there. But we're measuring a small little thin layer right through there. And we can see what the intima media wall, which is the first two layers of the arterial wall. And when we measure that, everyone has that. So we just determine what the age of your heart is by bringing that back onto our software.
So Diamond, normally you'd go back and you would look at this for a few minutes, but just overall, does it look okay right now?
Yeah, I mean, it looks really good. There's nothing wrong with that, Deb? It looks pretty clean.
Nice,
and that's the idea. Is unfortunately, the first symptom of most heart attacks, unfortunately, is death. And so, obviously, if we can screen people and find out and tell people really where they fall in terms of their risk, so that they can prevent or reverse the heart disease, that's even better.
There you go. So far my arteries are looking good. So we'll go for our fourth test coming up next, Tara.
Mike Yawney, a very brave man this morning. We'll check in with him once again before the show is over.